Hello, I'm Dr. David Green, CEO of PainManagementLasVegas.com, where we bring you anything and everything education for pain management. Today the topic is a very exciting one, and that is PRP, which is platelet rich plasma. Now, the reason that PRP is so exciting is that it falls into the regenerative medicine category, which is the newest and greatest types of procedures for pain management and orthopedics. So what you have is procedures that can regenerate and repair tissue as opposed to just giving good pain relief but not actually fixing the problem. So that's what makes PRP so exciting, but not the only reason. So PRP involves taking your own blood. So it goes a simple blood draw in the office, and then your blood, it's about 30 to 60 cc's. It gets spun down by a machine called a centrifuge, and that just takes a few minutes, but it goes really, really fast, and it separates the blood into 3 layers. One are the red blood cells on the bottom, and that's discarded. That's not part of PRP. The middle layer is called the buffy coat, mostly white blood cells. That's not used either. It's the top part that has the platelets, the growth factors, and things called platelet-derived growth factors that are what's used for PRP. So you end up with 30 to 60 cc's, and after it all gets spun down, it gets down to about 5 cc's, which is actually what gets used. Now, what's going on is when that medication gets injected into the problem area, it will cause an inflammation reaction, and that may actually cause more pain for a couple days than previous. But then what it does is it starts to pull in stem cells from your own body that can heal the area. And those stem cells can turn into cartilage cells, muscle cells, skin cells. So right now, PRP is being used for tendonitis issues such as golfer's elbow, tennis elbow, rotator cuff tendonitis, Achilles tendonitis, problems around the knee such as patellar tendonitis. It's also being used for tendinosis, which is basically tendonitis that is just on to cause much chronic types of pain. It's also being used for ligament injuries, such as around the knee, medial collateral, lateral collateral ligament injuries. And the latest is that it's also being used for arthritis conditions. And it's showing some promise there in small studies. So that's what's really exciting, because arthritis affects tens of millions of Americans. And if we can find something that can really be of benefit, and there's some stem cell injections that are being studied, and PRP injections are often called stem cell injections because they pull in your own stem cells and can be very helpful. Okay, so that's where we stand with PRP injections. They're done as an outpatient. They are not covered yet by insurance, so they're out of pocket, but they don't cost thousands and thousands of dollars. Okay, so that they are very attainable, and they're available now at a lot of pain clinics in the Las Vegas area. Okay, the procedure is outpatient, takes probably about an hour, and the risks are very low. There's a small risk of infection. There's a small risk of an allergic reaction if there's some numbing medicine or anesthesia used. But think about it, it's your own blood, okay? You're not going to have a rejection from that. You may have increased pain for a couple days because of that inflammation reaction, but overall the risks are exceptionally low. Check out my website at PainManagementLasVegas.com. There's a lot of in-depth information about platelet rich plasma, as well as a ton of other pain conditions and procedures. I'm Dr. David Green, CEO of PainManagementLasVegas.com. Your pain stops here.